Hello, my name is Eric Moya, and I'm here on this little video to talk to you a little bit about the new class I developed called CranioSacral Therapy, working with chronic depletion. And I'd like to take a few minutes and just talk a little bit about what chronic depletion is and basically how the course is set up and hopefully get you kind of excited about the course. It's certainly a course I'm really excited about. So first off, I should introduce myself a tiny bit more. Once again, my name is Eric Moya. I am a diplomat certified craniosacral therapist, and I've been teaching for the Upledger Institute for about 14 and a half years now. I teach Cranial 1 and Cranial 2 and the clinical applications classes, as well as this new chronic depletion class. You might also know me as well. I moderate the Upledger alumni group on Facebook, which is a pretty popular group, as well as the Manual Therapy Forum. Some of you might know me from there. Now, beyond teaching for Upledger, I have two backgrounds. One was as a massage therapist, and the other one was as a mental health counselor. First, I was a massage therapist, and then I became a mental health counselor later. And in addition to that, I do have a good background in training and coaching, and I've been an administrator. I worked as director of education at the Esalen Institute for 5 years. And I've been in practice for about 18 years now as well. So I have a good chunk of background behind me, and I love the work, and I'm definitely a career therapist in whatever way that I can be. So now, related to chronic depletion, this is a topic which I really believe is becoming increasingly important with each year of practice. I find it to be a much more relevant topic now than it was even 10 years ago. And I think a lot of us who are practitioners are working with clients who are chronically depleted, even if we're not quite sure of it yet. And sometimes it's a population of people, and that can be kind of challenging for us as practitioners, which is why I think a course like this is really important, an important addition to the Upledger curriculum. So you probably have clients that come in that have unpredictable reactions to treatment. Perhaps they have adverse or negative reactions to treatment, or really no reaction to treatment at all. Perhaps these clients are hypersensitive to the environment around them, or even hypersensitive to the treatment that you're giving. The releases might come unusually slow. They might be making slow progress in their course of treatment. You might be noticing under your hands that their mind-body just seems to have a decreased capacity for healing, a decreased capacity for compensation, and just less resiliency. Sometimes it even feels like their inner wisdom itself kind of has a blanket over it, kind of a muted quality to the inner wisdom. And of course, these people might, your clients might very likely have mixtures of chronic conditions. They could have TMJ problems, sleep problems, digestive problems, stress, anxiety issues, autoimmune challenges, really any number of stressors just that seem to all be coming together at the same time with these people and these systems which really have a hard time working with that. In short, I'm hoping you're getting the picture that with a chronically depleted client, there are often a whole host of factors colluding together that make it less likely that the client's going to continue on with treatment and be less conducive to a feeling of you feeling successful in your practice with these clients. And yet, these are the clients who really need our help the most. And so my thesis is that we need a new skill set, a skill set that really helps address this and makes us better prepared to work with them. Because oftentimes what happens is we unwittingly fall into a trap of chasing individual restrictions and individual problems with little apparent success, when what we really need is we need a refined skill set of addressing the whole mind-body picture and mind-body system of that particular client. Craniosacral therapy working with chronic depletion is about developing those tools and using them in your clinical practice. Now, a couple details about the class itself, and then I'll go ahead and close out our little chat right now. It is a 3-day class, like I said, 18 credit hours. One of the first things you'll notice about the class, if and when you take it, is that we actually do a bit of a review of Cranial 1 and Cranial 2 material. But we'll be doing a review of Cranial 1 and Cranial 2 material from a chronic depletion point of view. So right away, we're taking skills that you already know and learning how to use them in a deeper way, a more knowledgeable way, specifically with respect to chronic depletion. We'll of course learn how to identify, assess, and evaluate a mind-body system for chronic depletion. We'll even learn how to work with facilitation, and we'll take the facilitation work from craniosacral 2 and take it up into even the brain as well. And then to me, one of the things that's most exciting about the class is we're going to make a big shift and learn how to focus not just on individual restrictions, but how to engage an entire network of restrictions or an entire pattern of restrictions all at once. This kind of work is the work that I call the epicenter work, and I really think it's an exciting tool for your private practice. And then another good chunk of the class as well is we're going to be talking and learning how to practically integrate this information into the clinical setting. So we'll be addressing charting skills, we'll be addressing important client education skills, we'll be addressing important self-care skills, and as well as have a good discussion about how to keep you as a practitioner resilient as well. All right, hopefully that whet your appetite a little bit. I really hope to see some of you in there. Heck, I hope to see all of you in the classes. If you have any questions, send me an email, eric@ericmoya.com, or you can find me on Facebook. I'm on there all the time. My professional page on Facebook is Eric Moya, CST-D, MS, Mfct. And anyway, hope to see some of you there. Have a great day.